I'd like to turn it over to Dr. Huma, as one of the world's, global health experts. You bring a unique perspective to true barriers to access. We heard in terms of, how to address the financial barriers, and we really need to marry that conversation with the barriers to access to primary care at the local community level. Can you share with us your assessments of the barriers and the role that the female healthcare workers can play in expanding access to primary health, particularly to manage the conditions that are needed, and how we refer them for secondary and maybe tertiary interventions?
Thank you very much for a easy but still a difficult question. As Usman told you earlier, that our healthcare system is mostly focused as a tertiary care system and not as a primary care system. Although I'm a gastroenterologist, I'm a specialist, but by and large, I'm a public health expert. And I'm a firm believer that until and unless we have a good primary health system, primary health care going on, we will not be able to achieve the SDGs and the other, targets that we have to achieve. The reason being that our community, the community in each country kind of lives close to the primary health care. So if the primary health care is very strong and there's a good access, there is a good, equity, there is a, timely, their issues are resolved, then almost about more than 60-70% of the times the issues can be resolved, there and then at the public health facility. If I'm allowed to, share with you some of the facts that we have a non-communicable, Pakistan has a dual burden of communicable and non-communicable diseases, and the two together make almost about 70% of the disease burden. And, these are all people who are sitting in the primary, in the community level or at the primary healthcare site. And we cannot imagine that they will come to the tertiary care site for their testing and treatments and then will be healthy. So the systems have to be strengthened at the grassroots level. And so is the issue with our, women who deliver at home. Almost about 50% of our deliveries are, occurring at home. So again, we need a lot of, midwives and the lady health workers and the people who can help in picking out the women who are high risk and then kind of connecting them to the primary and the secondary health care. So the barriers actually that I see are actually, one is the very poor health facility at the primary health care level, which is kind of, almost very bare minimum. So that this has to be improved. And then is the availability of the healthcare people there, because by and large, if the facility is not good, then the healthcare people, the doctors, the lady health, the lady medical officers and the other people, they don't want to go there. So if they are not there, then the facility is good for nothing. So we have to kind of entice women and, health workers to be there at the primary health care level, so that the people, it could be men, women, or even children, to access the place. So it's the health systems by itself, and then is the availability of the healthcare staff, and obviously the commodities, which means the supply chain. And then the, access issue, that, the access to the health facility, the roads, the travel distance, the commutation to that site, again, is issues. So frankly, and that is the reason that, the people then find it much more easier to travel to the tertiary care. And they come to the cities and get their basic rights from the tertiary care. And that's why our tertiary care is choked. We cannot provide the tertiary care that we should, because at the tertiary care, we are actually providing the primary care. So actually, we have to really revolutionize our systems and really invest a lot in the primary health care. And for this, we also, like Usman told you, that we have almost 100,000, slightly more than 100,000 community health, these lady health workers. And these lady health workers are actually the community women, the women living in the community. And they're selected from within the community, and then they go in the same community and they get kind of, work for identifying the women with high risk pregnancies, identify the children who are undernourished or who need vaccination or fertility control, MNCH issues. So actually, once we develop this good system at the grassroots level, then I think that most of the barriers to access to health and education similarly can be resolved. Thank you.